Welcome everybody to London Vegans. Thank you for joining us this evening. We meet the last Wednesday of each month, apart from December, and we have online guest speakers. And tonight's guest speaker, I'm pleased to say, is Dr. Shireen Kassam, who's joining us for the second time, I think. And this particular presentation is about promoting, well, opportunities and barriers to promoting veganism within the healthcare system within the UK. So without further ado, let me hand over to Shireen. Thank you for coming on tonight. Thank you.
Oh, well, thanks ever so much for the invitation, and I hope my talk is interesting to you all, and we'll look forward to some questions at the end. I'm just going to make my screen, change my view, 2 seconds. So I kind of gave myself this title just really as an opportunity to share with you what we're doing at Plant-Based Health Professionals UK. And hopefully by the end you'll be wanting to support some of our initiatives, or at least spread the word. A little bit about me for those of you who don't know me and Plant-Based Health Professionals. I work as an NHS consultant, as a haematologist at King's College Hospital. I'm also certified as a lifestyle medicine physician. I guess I'm here as founder and director of Plant-Based Health Professionals UK, and we'll talk about that a little bit more. I'm sustainability lead for pathology practice for the Royal College of Pathologists, and then I also teach at the University of Winchester, and I've been vegan since 2013. So I guess it's useful just to set the scene in terms of who we are at Plant-Based Health Professionals UK. So we founded back in 2018, and we provide education and advocacy around healthy plant-based nutrition and lifestyle medicine for improving individual, population and planetary health. We are a vegan organisation in that all of us directly working for PBHP are vegan, and we all want to see the realisation of a vegan world. And I guess our theory of change, or where we fit into the kind of vegan movement, is that our belief is that to witness a transition to a plant-based food system, we need healthcare professionals to adopt and accept a plant-based diet and lifestyle as one that will benefit themselves, their patients and the planet. So we provide this education advocacy to kind of bridge veganism and the healthcare service, and making sure that at least topics around dietary choices are covered in various curriculum and conferences. And our vision is that healthcare professionals will use their knowledge, status and credibility to accelerate the transition to a plant-based food system, because we recognise that healthcare professionals are trusted messengers, and as vegan healthcare professionals we need to use our voice to further the vegan movement. Now, it might be a little odd to start with letting you know that the term vegan is not welcome in healthcare. I've spent the last 10 years trying to incorporate vegan principles and ethics into my workplace, but it's a hard sell for reasons perhaps we can discuss. But the V word in many settings has become one that leads to people becoming defensive. It's an emotional topic, and in healthcare settings it's thought as a sort of restrictive way of living that limits choice. Obviously all of us will have different opinions about that, but I think there's a lot of work to be done, and that's what we try and do, to normalize plant-based eating, given the sheer scale of the slaughter that goes on in the food industry. And even though it's difficult for me to advocate for a fully vegan lifestyle in my workplace, it doesn't stop me doing it. But what we concentrate on as healthcare professionals is trying to end the slaughter of all these billions and trillions of animals. So the way that we have gradually come around to doing that is trying to think about key levers within healthcare. And there are many objectives within the NHS, within healthcare settings, that really align with plant-based eating and to some extent veganism. So firstly being the One Health approach to delivering healthcare. And this is a sort of international consensus that we should be providing healthcare that not only benefits people, but benefits the planet and the animals we share. So that's kind of under that umbrella of One Health approach. I feel able to talk about planetary health and animals we share our planet with. The NHS was also the first healthcare service to declare a climate emergency, and it's the first to make a commitment to deliver a net zero healthcare service by 2045. So all aspects of healthcare have to decarbonise, and we know that food service is a large component of what the healthcare service does. It's around 6% of greenhouse gas emissions. So I should have said that healthcare services globally and in the UK contribute around 5% of all emissions. And of that, 6% is related to food. Now, it might sound small, but you wouldn't believe how much time and energy has been spent in converting people's asthma inhalers, talking about anesthetic gases, and getting rid of certain ones that are bad for the environment. But that accounts for much, much less. So actually, 6% of emissions of healthcare being food is something that we should use as a lever to promote lower carbon diets, which of course we know are those centered around plant foods. We are in a healthcare crisis, and we know that unhealthy diets are the leading or a leading cause of chronic ill health and premature mortality. I think I'll refer to this in one of my next slides, but just 2 weeks ago, on a Saturday, the front page of The Guardian reported on yet another report, but this specifically related to the UK, outlining the cost of our unhealthy diet. And it amounts to, the healthcare related costs alone amount to £268 billion in ill health, loss of productivity, etc., etc. And that's just the health impact. It's not even the climate impact or the impact on the animals. And that's more than the budget of the NHS, which is around 200 billion. And they said to fix the problem, it would cost 54 billion. And so it's a no-brainer. We have to address food. And within every report, it's stated that our diets are unhealthy because we're not consuming the foods that promote good health. So fruits, vegetables, whole grains, beans, nuts, and seeds. There's financial incentives, and we've had modelling and studies done to show that if we were to normalise plant-based meals, fibre-rich foods, we would have a significant cost saving with benefits for the environment and, of course, for our health outcomes. The healthcare service is also very, at least on the surface, is committed to providing an inclusive and equitable service for all. And I think, food equity and access comes into it. And we know that plant-based diets can deliver on inclusion, diversity, and equity. And I think the issue around social justice, healthcare really does concern itself with justice issues, whether it be war or famine, or the healthcare profession is advocating for all sorts of things. And of course, we know that veganism is a justice movement for people and animals. So those are the kind of levers I think we can engage the NHS with. And when I say healthcare service for the UK predominantly, 90% of care is carried out in the NHS. So just to home in on health outcomes and how we can advocate for healthy plant-based diets in terms of health. We know that there's many benefits of eating a plant-exclusive diet, and the benefits really come to the fore when for cardiometabolic health. So we know that people following a plant-based diet have healthier body weights, less heart disease, less type 2 diabetes, and certain cancers. And there is certainly emerging evidence for rheumatic disorders, fatty liver disease, Alzheimer's, and multiple sclerosis. But we do have to remember not to overstate the benefits, because it's not a panacea. People will still become ill. We're just shifting the odds in our favor if we address the biggest killers, which really relate to cardiometabolic health. And this is the study that I was referring to. So if you haven't seen it, it's from Food Farming and Countryside. It got a lot of exposure, but really highlights how, you know, the NHS needs to address food, and you know, one of the ways of doing it would be to adopt more plant-based meals. And the healthcare guidelines are really consistent in terms of what they promote as a healthy diet. So all of our disease-specific guidelines, be it for cardiovascular disease, type 2 diabetes, hypertension, cancer, they all state that a healthy diet is one that is predominantly centered around healthy plant foods. And I mentioned lifestyle medicine certification that I have. It's a lifestyle medicine is a specialty, evidence-based specialty that pays attention to healthy habits and the key drivers of chronic ill health, which really ultimately relate to our behaviors and our sort of behavioral choices. But food is recognized as, you know, being a key pillar of lifestyle medicine, and the specialty really uses food as medicine. And the American College, which is a founding organization, recommends an eating plan predominantly centered around fruits, vegetables, whole grains, beans, nuts, and seeds. And this is the plate that they describe, so whole food, plant-based diet. So there isn't much controversy, despite the narrative in the media and you know, social media as well. We know that a healthy diet is centered around plant foods. And we've done a bit of research as well as an organisation, and we hope to contribute more to the research. So our members, for those of you who aren't members already, maybe you will become after this, but we have a membership programme since 2019. We're about 1,000 of us. We'd love to grow. It's very affordable, and for that you join a community of like-minded people, and we're about sort of 2/3 healthcare professionals and a third non-healthcare professionals. Brian's a member, so you can ask him what it's like to be a member. So we surveyed our members to as a sort of self-selected group of people who've been following a plant-based diet for a relatively long time. Our members on average have been following a plant-based diet for around 5 years, and we've got people who've been following for over 40 years. And this was published in the Journal of Human Nutrition and Dietetics, a cross-sectional survey of around 300 of our members, assessing their dietary intakes through a questionnaire, their diet quality, and how long they'd adhered to it, their use of medications and their health outcomes. And overall, things looked favourable, you know, given the caveats of a cross-sectional survey. But we were able to show that, you know, the diet that our members are consuming are of high quality, with very little consumption of ultra-processed foods, that a number of people in the group improved a range of health conditions, especially benefits for body weight, and we know how important that is. And our average BMI was 22.4, and you'll recognise that being quite favourable because the average in the UK is well above 25. And most people considered their diets to be sustainable and associated with health benefits. So do have a look at that paper if you haven't seen it. Similarly, we've just had a paper published around the knowledge, beliefs and barriers to whole food plant-based diets amongst registered dietitians, because some of the major barriers we face are from our dietetic colleagues. We're lucky enough in plant-based health professionals to have a really strong core group of dietitians who are vegan, plant-based eaters, and who, you know, wouldn't be representative of their usual colleagues. But we surveyed 335 registered dietitians from the UK and the Republic of Ireland, and we were able to identify considerable knowledge deficits around whole food plant-based diets, whether it's related to nutrient sufficiency or benefits for health. Unfortunately, registered dietitians, 75% of them still considered plant sources of protein to be incomplete and require pairing of foods. People were still concerned about malnutrition and micronutrient deficiencies, and there was clearly consensus that was limited education around plant-based diets in their curriculum, even for people who had recently qualified. There's a lack of support in the work environment that I would also concur with. And they felt that there were many barriers that stopped them advocating for plant-based diets for their patients and in the workplace. So this is kind of the knowledge gap that we're here to fill, and we hope we've made some inroads. So we produce lots of fact sheets, and we're lucky enough that we've teamed up with the British Dietetic Association to produce some on kidney disease, but we've got an array of fact sheets that sort of support clinicians and everyday folk to access free evidence-based information around all the different types of health issues and how you can use plant-based diets and lifestyle to improve or prevent those conditions. We have written a textbook that is in many libraries now, because there wasn't a UK-based textbook on plant-based nutrition for sort of clinical practice. Probably needs updating already, but that came out in 2022. We teach in medical schools. We're lucky in the UK that 10% of the curriculum in medical schools can be chosen by the students, so they're called student-selected modules. And so we've managed to find a route into teaching in medical schools, whereby if we offer a student-selected module, they're happy to put it in their pool for students to choose. And so we teach at Exeter, Southampton, King College London, and recently Glasgow, Bristol and Kent and Medway have come on board as well. And we're planning to expand, because there's 42 medical schools, so lots of work to be done. I also teach a course on plant-based nutrition that's recognised for CPD by the Royal College of Physicians and the Irish GPs, etc. So that's at the University of Winchester. We have a podcast, if you haven't already tuned in. It's called In a Nutshell, and it's really fantastic, really talking about the evidence and practical application of plant-based nutrition for healthcare. So I'm just going to move away from sort of talking about health, but to talk about sort of climate and ecological benefits. We all know the evidence showing us that the food system currently is a leading driver of climate breakdown and ecological, biodiversity loss. And we know that without addressing the food system, we can't meet any of our climate and nature targets. We also know that we need to move to a plant-based food system. And this is actually within the government guidance as well. So there's a series of documents, if you haven't seen it, called Applying All Our Health. And even though we haven't had a new dietary guideline, there are these documents that clearly state that, the foods that are damaging our health are also damaging the planet, and a diet rich in plant-based foods has significant benefits for both. And people who choose to limit consumption of animal products can get all their nutrients from a plant-based diet. So that's great. And we have an organisation called the UK Health Alliance on Climate Change that we're a member of, and so are a lot of medical professional societies like the Royal Colleges and the disease-specific specialties. And they represent over 1 million healthcare professionals advocating for climate-friendly policies such that we impact health positively. So they're all about raising awareness around the impact of climate change on health outcomes. And they have also got a position statement. I've managed to get them to sign the plant-based treaty, which I was happy with. And they've got a statement and policy papers that say that we need to normalise plant-based meals, especially in healthcare settings, but of course to shift the food environment and the food system in the UK to one that prioritises plant-based foods. And this is also in the sustainability curriculum for medical schools as well. So this is their curriculum, came out in 2018, if I'm not mistaken. So been there quite a while. And it talks about food as medicine. It talks about the benefits of a plant-based diet to health and the planet. And, it sort of allows medical schools to, teach on plant-based diets as it relates to sustainability. So again, it's a great lever for us. And so we've teamed up with a lot of climate active organizations. So there's many more organizations, healthcare-led organizations, calling for climate mitigation strategies, ends to fossil fuels, etc., than there are organizations like mine that are, advocating for the plant-based transition for health and planet. But nonetheless, they all recognize the benefits of a shift away from animal agriculture. And so we do a lot of work supporting their work, and likewise they're happy to use our resources and publicize them. And so with that kind of sustainability lens on, our courses, our fact sheets, our educational resources are recommended by the Royal College of GPs in Ireland. Actually, then, sorry, it's not Royal, Irish College of GPs, and also the Royal College of GPs for England. Their toolkits for sustainable healthcare include all of the work we do. So I've pointed out here our courses. So that brings me to campaign that we've launched that I hope you've all heard about, called Plants First Healthcare, and it's really getting its inspiration from the work in New York City, where 11 city hospitals have transitioned to plant-based meals as the default option. So we're calling for plant-based meals to be normalised within all healthcare settings in the UK, because we know it's better for health and the planet. It can be inclusive of all cultures and traditional preferences, and can be allergen-free. And if we talk about plant-based meals as a default, the strategy really is around using choice architecture and evidence-based behavioural strategies to support patients, staff, visitors to make that better, healthier, sustainable choice without restricting choice. So in New York, for example, the way they do their lunch and dinner service, the food hostesses will go into the patient's room and offer them the primary dining option, the chef special, and that will always be plant-based. If they don't want it, they'll be offered a second chef special, which is always plant-based. And if they don't want that, then they'll be offered the rest of the menu. And after 2 years, they've shown that 50% of people stick with the plant-based choice. They've reduced carbon emissions by 36% from catering and healthcare. They've saved about £500,000 because each plant-based meal is 59 cents cheaper than the animal-based meal. And they've maintained really high patient satisfaction. So it seemed a no-brainer to bring this to the UK. So I'll come back to that in a minute. So what we've also done as part of our food and healthcare report that you can find on our website, which has got a lot of detail about normalising plant-based meals, is that we've analysed 40 NHS trusts' documents around their commitment to changing the food environment to one that prioritises health and sustainability. And no surprise to me anyway, being in this in the NHS for the last 25 years, there is very little commitment, and only 5% of the trusts have got an aim within their green plan, which is meant to outline their commitments to sustainable healthcare. Only 5% have got an aim to promote plant-based options to patients, visitors, and staff. Whereas, as you might imagine, it's quite trendy to be saying you want to eat local, but there's a sort of conflict there, because we know that most of the food we produce in the UK is from animals, and only 15% of farmland is dedicated to growing plant foods or crops that are consumed by us as humans. So a lot of work to be done there. We've surveyed our patients, so we've done a survey which we published, and the references down there. This is at King's College Hospital, because we wanted to challenge the notion around people always telling us that you cannot limit choice in the healthcare space when it comes to food, even though I disagree with that. We limit choice on so many levels. We don't let people smoke or drink alcohol. We ask people to wear masks in certain settings. So choice is naturally limited in the healthcare, and when it relates to a restriction that's better for health, I don't see a problem, but others do. But we asked our patients, what do they think if we were to remove red and processed meat from menus because it would be better for health and the planet? And actually most people, around 70% of people, didn't seem to mind, especially when they understood why. I guess the trouble comes when we ask them what they would choose instead, and people would choose chicken and fish to consume instead. And clearly we need to do more education around supporting people to choose beans and legumes and tofu and all the other great sources of protein that don't come from animals. We've asked our staff as well, this is in our food and healthcare report, around what they would like, and people are very happy to have more dishes with lentils and beans and tofu. They don't mind having dairy alternatives. They're happy. They don't mind. I mean, a third of people don't mind removing red meat. But of course, we know when it comes to staff and visitors, we generally make choice based on taste, convenience, and price, and we sort of need to get that right in healthcare settings as well. We've also recently conducted a consumer survey with one poll of 2,000 UK adults to really support our work around food and healthcare. And we asked them specifically around plant-based meals. And we were surprised, actually. Well, we weren't surprised that most people thought that food and healthcare needed to be improved. So food in hospitals was not adequate. So that we weren't surprised at. But what we were surprised at, that most people were supportive of plant-based dairy alternatives, and over a third of people would be supportive of an entirely plant-based menu in the NHS. And this is based on participants of only about 2% identified as vegan. So, when we say people won't accept it, they won't like it, well, I think, we don't know until we ask and we try and we bring people along with us. And if we were to even get to that 50% of uptake of plant-based meals that New York City has done, that would be amazing. And again, people want taste, convenience, familiarity, that it looks delicious, etc. That would make them choose it. So our choice is not necessarily purely made around, animals versus plants. People want those sort of familiar comfort foods, which we know we can make from healthy plant-based ingredients. And, people understand that meat-free meals can be healthy, more sustainable, inclusive, etc. So what's happening now in the NHS? This is not such a good news story, I'm afraid, and I think some of you will probably recognise this from your experiences in hospitals. Just starting off with some pictures somebody sent me from the NHS weight loss app. It's a little disappointing, isn't it? Because why would you show, a cow or steak on as something desirable for weight loss? I mean, it's far away from the evidence, and there's very little showcasing of plant sources of protein, so that's disappointing. This is my hospital staff canteen. This is the choice of sandwiches. This is what welcomes us to the staff canteen every morning. In fact, all of the day, the same posters there. And then this somebody sent me from their hospital. I mean, this is a classic. Nice to meet you. I mean, we're so far away from normalising plant-based meals, and this is a trolley at Exeter Hospital full of ultra-processed food. So we're not doing a good job right now. What we do feel that there has been some sort of shift is menus do have more plant-based options. And in my hospital, with the caterer Compass that caters around 30 different hospitals, we and others, we feel like it is our advocacy work, but certainly we've been putting pressure on them to list the plant-based meals as the first. So you've got vegan meals first and second on the menu. So when you open it up, it's the first couple that you see. Not necessarily translated into people choosing it, and that's a different conversation, but nonetheless, there are some good options. But I still have issues with the fact that the beef dish gets a heart healthy symbol. It's just so counterintuitive to me, but anyway, this is the situation we're in. And this unfortunately, even if the menus look great, which I think my menu does look quite good, the one we've got at King's, there are definitely options on the main menu. But when people post in the Vegan Hospital Network Facebook group, and I've had permission to use this is kind of what you see. There's such a variation. This poor person got vegetables and a banana. I mean, and this meal at the top right doesn't look too bad. So it's a bit of a postcode lottery, as we recognise. And hence coming back to our initiative, Plants First Healthcare, where we're calling on the NHS to normalise plant-based meals as the default option for health and sustainability. And we've got around 22 organisations that have endorsed this open letter, endorsed the initiative, and we sent an open letter to all NHS hospitals and healthcare leaders on 16th of October, which was World Food Day, and we launched alongside the UK Health Alliance on Climate Change, who've published their report recommending plant-based meals as a default option as well. So we started getting responses back. Have a look at our website. There's lots of resources in terms of how we plan to implement this. And then I want to remind everyone, in case it's relevant to you, that workplace is a great environment for advocacy. So we should use our voice in our workplaces. I've had variable success. It's good to celebrate the small wins that you've had. Our strategy that will come to an end soon, 25, it will be reviewed, but we did manage to get these sentences in that our catering partners will move to a healthier, more plant-based menu and will progressively remove processed red meat. Let's see if it's achieved. You saw our menu and there's some improvements there. We run Veganuary and No Meat May campaigns every year, so we're doing it. This will be our 5th year. We promote it mainly to staff, and we have incentives, we have a free lunch, we do lots of things, we've got a cookbook, and we have a WhatsApp group and support people, and we really have created new vegans at King's College Hospital. Other wins that the catering events or catering at meetings in my hospital are meat-free. There's no extra charge for soya anymore, and our food options for staff in the vending machines, there's definitely more plant-based options than there used to be. And then just to remind you about things that I haven't talked about, but our key levers in healthcare, just bringing it back to the One Health agenda of having global healthcare delivery that recognises health of people, planet and animals. So I think, the other things that we talk about and that are really important to highlight to the NHS is around antibiotic resistance. We know 70% of antibiotics globally are used in farming, around 30 to 40% in the UK. We know that antibiotic resistant infections are rife within farming settings and then pollute our land and waterways. Air pollution, 30% of air pollution in our cities comes from farming, and most of that is from animal farming, from manure and also fertilizer use. Water pollution, we all know about the story of the River Wye in Wales, chicken poo in the water, death of biodiversity, and also making the water unsafe. Food safety, most foodborne infections come from animals and their feces, and of course pandemic risk. And just today's Journal of American Medical Association, there was a report from the CDC documenting 17 cases now of dairy workers in the UK getting bird flu because they work with dairy cows. It's worrisome. So my learning to date, after a good 5 or 6 years of trying to advocate for veganism in the workplace, is it's difficult to use the V word. So we need to use narratives and language that appeals to the NHS and that pulls on levers that are important to them. And there's plenty, and I hope I've demonstrated that. We need to infiltrate established structures. So that's where I think we have value as healthcare professionals to be able to offer this education advocacy in a setting where we have a voice and credibility. We must use our networks, and so that's what we do at Plant-Based Health Professionals, empower all our members to go out in their workplaces, in their healthcare settings, to teach, educate, advocate. And it's always veganism. We know we must persist. You can't give up, and it's hard uphill struggle. But I kept optimistic by more and more healthcare professionals coming on board to promote a more compassionate and kinder way of living. And I get hope because I read articles like this in our medical journals. American Journal of Cardiology back in 2022, an editorial titled "Are We What We Eat? The Moral Imperative of Medical Professionals to Promote Plant-Based Nutrition." The medical profession can help to move the needle by embracing radical change when possible, especially within our own ranks, and incremental change when necessary to promote harm reduction. We owe it to the profession, to our patients, and to the planet we share. And of course, we'd all agree we owe it to the animals as well. So thank you very much. I think that's my talk done, and I'd be very happy to open up to discussion. And I'm also going to pop our website links into the chat. I would hope that you've seen it already, but in case you haven't, I'll pop that into the chat for everybody.
Thanks, Shireen. That was fascinating. I mean, it's an area which is of interest to so many people. And I mean, hopefully we don't need to go into hospital, but at some point we might need to. Well, I don't know if anybody got any questions. Please do put your hand up, or if you can put the post into the discussion group, and Shireen will hopefully answer. I think John has got his hand up. Don't you want to? Unmute yourself, John. Yeah.
Am I muted? Can you hear me?
I hear you now. Yeah.
You can hear me. Good. Yes, I'm just wondering whether it'd be worth having as an option, because when I went to the hospital once, I was told they couldn't have vegan meals because they've got halal meals and isn't room for both. But if instead of calling it vegan meals, you called it zero cholesterol meals, then it's much harder for them then to say no, we can't have zero cholesterol meals. Would that be an option, calling it referring to the zero cholesterol meals?
I don't know. So I mean, the menu names and stuff are very sort of long-standing, but I would like to suggest that, I mean, all hospitals will have what they call their kind of, religious special menus under which there will be vegan dishes. Whether those are available is a different matter, but they will have a menu and they are duty bound to, for all the reasons we know, for inclusion. And so if you don't, then obviously one needs to complain to PALS, and we have a fact sheet on how to access vegan meals in hospitals and how to raise your voice if you're not getting one. I don't know that zero cholesterol will go down terribly well because people are not that fussed about eating dietary cholesterol. Most people aren't. So I think we'd have to find a different way. But yeah, it's an interesting thought.
Right. Okay, thank you. Yep.
I was going to actually ask a slightly related question, which was that for different hospital departments, so in other words, for the department that is specifically dealing with heart conditions, would they be having separate meals for that department? And presumably they just eat the same rubbishy food as the rest of the hospital.
Yeah,
and it's not tapered. It's not tapered.
Absolutely. So the type of menu I showed you is meant to be applicable to the majority of people. So people say it's meant to cater for 90% of people in hospital. But some people will be on specialist diets, and they're usually people with kidney disease, liver disease, plus or minus type 2 diabetes. But the majority would expect to get their meals from the type of menu I showed you, which, yes, does include red meat, processed meat. You could have it for lunch and dinner if you really wanted to.
Thanks. I know we've got Margaret that's got a hand up. If you want to unmute Margaret, Margaret's based actually in New York, so
I'm
able to fill us in what's happening over there.
Yeah, great.
Yes, I had to chime in here. Thank you so much for your talk, but I was especially startled to hear this good word about New York. I mean, we don't often lead in anything positive. So, so I was really happy to hear that. I was aware of this primarily because a friend of mine last week was in the hospital for a hip replacement surgery, and I learned that they had a vegan menu that was the primary menu. You know, if you wanted something different, you had to specify that. But vegan was the norm, and it was called vegan. It said vegan menu, and I looked at the menu, and it looked really fantastic, like the kind of place you would want to just go out to eat. So I asked, you know, can you go there and just, you know, have a meal? And unfortunately not. It was for patients only. There was just the tiniest little cafe there that just basically had coffee, although with plant-based options. But no, it was just for the patients. But still, very nice, you know, to see that that was the norm.
Yeah, it's brilliant. And clearly, you know, having it as an initiative out of the mayor's office has given it that, you know, high level support that unfortunately we're lacking. But on another note, as I say, we've taken all our inspiration from that work that's already been done in New York, and we've partnered with Greener by Default, who's the organization that sort of was involved in implementing that. And they're working with us here in the UK. They've appointed a UK healthcare manager. And so there's one thing that we've taken, we've launched an initiative. We actually have a route to action, just so everyone knows they can work directly with Greener by Default for free in their NHS trust to implement plant-based meals as a default. So we're trying to get rid of any sort of hurdles that people and barriers that people put up. Yeah, we are hopeful to start getting some pilot sites and some data soon.
Thanks,
Look
Margaret.
forward to hearing your updates.
Thank you.
Thanks for that, Margaret. There is a budget, I understand, of how much they can spend per person on a meal, and I don't think it's that much within the NHS. I think it's very low, isn't it?
Yeah, I don't know the exact figures, and I think it probably varies based on how the food is provided, and that in itself is complicated with private providers, so third sector providers versus in-house, etc., etc. But only to say that again, New York City showed that each plant-based meal is 50 cents cheaper on average than the meal with animals. So it's like, well, what's to lose? Yeah.
I would have thought it would be the same in the UK. I mean, if you're having lentils rather than meat, I would have thought that would be cheaper. I saw somewhere, and you may recall, there was something in the news a few months ago about corn partnering up with some, I thought it was sort of, I don't know, it was hospitality or whether it was the healthcare system, to incorporate some corn into some of the products. So there's less meat and more corn, which then I'm assuming they're saying, well, it's now environmentally friendly. Is that, do you know anything about that?
Well, I mean, I only just saw a sort of a headline saying that, the NHS was partnering with Corn for, 50-50 meals or whatever. So I think I've seen this same headline. I think it's going to depend on the way the food is provided. So I don't know who that's with, because if you've got in-house catering, you can do that and your procurement can have these contracts and all the rest. But, from my experience with working with Compass and ISS, it's very difficult to kind of make those sort of novel changes. So I guess wait and see. The NHS has actually launched a recipe bank as their kind of initiative of, overhauling meals. But again, how it's going to be implemented, not entirely clear. So watch this space. We've now got regular meetings with the NHS food the food group, the NHS Net Zero food group. So Philip Shelley, who led the hospital food review. So our next one's tomorrow. So we're hopefully trying to figure out routes of entry and collaborations. So yeah.
Excellent. Good to hear.
I think Paul Appleby has written a question to me directly. Is it okay, Paul, if I read it out then? Because I guess nobody else is going to be able to see it. Or is it?
Yeah, that's fine.
Yeah. So you ask, how does so Plants vs Healthcare campaign targets hospitals? Well, not really. It's around food and healthcare. We've sort of launched by having a focus on hospitals, but of course, there's many healthcare settings, including conferences and events, and our next trawl of sort of campaigning will be, asking the Royal Colleges and medical societies to make a commitment to 100% catering at conferences and events in the same way that plant-based universities and councils and stuff have been calling for that. So that's on my list of ambitions. And when it comes to GP surgery, so what we do is empower our members with the knowledge to take it back to their GP surgeries and advocate for this way of eating. We provide fact sheets that they can pin up, and we know that our fact sheets are really widely used. People send us pictures of it up on their surgery. So we provide them with the resources that they can put up for patients, for staff. We support Veganuary and No Meat May initiatives with the small bits of funding, so people can showcase plant-based eating and meals and have events during those months. And then I showed you two toolkits there, one from the Irish GPs and one from the Royal College of GPs, that have all incorporated our resources as part of their recommendations. And in England, this is the Royal College of GPs Green Impact Toolkit, it's called. So the sustainability toolkit, there's awards. So there's bronze, silver and gold awards for GP practices that are demonstrating sustainable healthcare. And then the silver award, I contribute to the food side of that. And the criteria is that, you have a champion who champions plant-based eating in the surgery. You swap out your dairy milk for plant-based alternatives. You have meat-free lunches, and people do our courses. You take our webinars and use our resources. So we're kind of in there. And I guess the way to support us is just to join as a member. It's a layperson. You can join for £25 a year and join our network, so you know the work we're doing, contribute to it, be part of our campaigns, be our messengers, but just showcase our resources to everyone. Most of it's free, so tell people about our webinars, our fact sheets, our conferences, our events, all sorts of things that you can do. Our website hopefully makes it clear. And then if you could also then send our open letter around Plants First Healthcare to your councillors, your hospital CEO. We've got a call to action on that. At the moment, we're sending our template letters to the Chief Executive of the NHS, Amanda Pritchard, but we'll shift that around to somebody, some other victim soon.
Right. So can I just thanks, Shireen. Sounds like you're getting better access to GP surgeries than I am. You know, when I go along, you know, you have to fill out a form or go online and fill out another form. And if you're lucky, you might get a call back from your GP sometime.
Yeah, I hear you. I mean, there's lots of reasons why we've ended up in that situation. But yes, we have a lot of GP members who are spreading the plant-based message, which is our goal.
Good.
Okay, thanks. Question, Shireen, from me is, I've been told on various occasions that within the however many years, it's 7 years training to become a doctor, there's something like just a day on nutrition. Is that right? Is that?
Well, so we don't get much, and you know, but we don't get much of anything, would be my kind of answer to that question. I'm a hematologist. I didn't learn any hematology at medical school. I learned it in my postgraduate education.
Okay.
So it's not really an excuse, but it is a statement of fact that not many hours are dedicated to nutrition. As I say, not many hours are dedicated to many things because it is a career of lifelong learning.
Yeah.
But 2021, there is now a curriculum for medical students, a nutrition curriculum for medical students, a bit like the sustainable healthcare curriculum that I showed you. The trouble with having all of these curriculums is it's still down to individual universities to incorporate that into a very, very, very busy and ever-expanding schedule. So implementation, I think, is very variable. Unfortunately, that curriculum, if you bother to read it, unfortunately, the only time it mentions plant-based or, well, the words vegan or vegetarian is under the statement around restrictive and nutrient deficient. So I wasn't best pleased about that, unfortunately.
Yeah.
Right.
I was just
Thank you.
wondering, in terms of, you know, for those people who are in hospital, or actually even anybody going to their GP, I think the fact that when you go to somebody who is a GP, whether wearing a white coat or not, there is the level of trust in that person. And if they advise you to take a certain medicine or whatever, then most people, I don't know necessarily we as vegans would take all of the things that we're offered, but for many people, they just take them on the basis that they're being offered by the GP. If you're in hospital and if the person who's coming around with the food says, this meal is going to be beneficial for you for whatever the condition that person's in for, then I think they're more likely to say, yes, I would like to have the plant-based option rather than the meat option or the dairy option. But I don't necessarily think, I mean, I'm assuming, I don't know, thankfully I haven't been in hospital, but I'm assuming that they're offered a choice of food, but they're not given any advice with that food as to whether it may or may not benefit that condition that they're in for.
Yeah, I mean, I think the reality of the food service on the ground is pretty dire. I'm witnessing it myself with, unfortunately, my father's in hospital at the moment and he's vegan. And despite having a beautiful looking menu online, when you look to see, there's never an option available. You know, even basic things like baked beans and jacket potato, they swap in a tuna option instead because they didn't have beans. So, you know, the reality of what's being served is far away from what it should be. But also, for example, in my hospital, I've shown you a relatively good menu with some beans and legumes and various things on. But when we follow around the food service hostesses who are obviously going to be on the lowest banding of pay and, are kind of, service staff. They go into the patient's room. They've got like 30 patients on a ward in a real hurry, and we've witnessed them say, "Do you want the beef, chicken, or fish?" So it's like none of that good work is then translated into the patient's room. There's no discussion about that, and it's down to potentially the least qualified person to take the food order. There's no way that most consultants are going to be talking to their patients about what they should choose from the menu. It's just not going to be, none of us have got the headspace to be doing that sort of thing on a busy medical ward round. So the person that is going to be the least qualified kind of domestic staff who is literally taking an order on a iPad.
I think I've got a recollection, but it may have all changed. I thought they leave a sheet of paper with the options for that meal, that day's meal. But do they still do that?
Again, it's really variable. So everybody should have a menu. Like that's a basic standard. So everyone's room should have a printed menu. Whether that happens or not is a different matter. I know that that's not the case in my hospital. People don't necessarily get the time to even view the menu. But in many hospitals,
if they fill in a piece of paper on the menu itself is where really the advice, the nutrition advice should come in, saying, this is good for you if you've got a heart condition. If you've got certain cancers, you should be avoiding certain foods. But I'm assuming that none of that's happening.
No, so whether people actually see the menu is 50-50, but also the order is definitely taken electronically, because then you it should be as well taken electronically in some format, because then you can get some audit data and sort of assess the uptake of various meals and things like that.
Any final questions?
Peter Despard here.
Hi, Peter.
I'm in hospital.
Yeah, at the moment, yes.
I've had a lovely meal half an hour ago.
Okay. What did they give you?
Well, you choose. I'm choosing for. I don't know if you can see it. Can you see me at all?
Hold on a second. I can't.
Got the religious, cultural, and vegan lunch and supper menu. It's pretty good.
You're not on my. You're not up on my screen, so I can't see.
I can see. Maybe you just need to scroll.
Yes, I can see it.
I can see it. Yeah, so you said it's the religious, cultural, and vegan menu, and that's kind of usually the labeling that's used. Which hospital are you at, Peter? Oh, no, he's gone.
Peter. I know he's on his mobile phone, but maybe they've cut him off.
Maybe.
Oh, there you are. I can see you now. Let me just. Okay, I'll just.
Okay, I'm on a so-called smartphone. But I'm in hospital right now. You see the curtains there, and I'm pretty pleased with having a vegan items on the menu. When I remember when it was that vegans had to bring in food, there's nothing to eat at all. So it's improved a lot. My main complaint is with medicines. They don't accept this concept of vegan or animal-free or cruelty-free medicines. There was a big battle at Norfolk Park about this. Not too bad. I'm in Barnish at the moment. That's not too bad here. They're trying to get the right medicines for me that don't have any animal products.
But Northwick Park is, there's quite a lot of Asian population around the area, so I would have thought they would have as far as plant-based and vegan meals, I would have thought they would.
Yes, got Jane section, which I've just sampled. Very nice.
Oh, well,
only it's white rice always, but then Indian food comes with white rice, doesn't it? So
thanks for that.
There was an argument that people should be given the food they're used to and they're most comfortable with when in hospital, rather than something that's really good that they don't like, because that's better for their. I just wonder if that's something you take into account.
Yeah, well, that's the thing, and that is the pushback we always get from all the stakeholders, is that people in hospital expect to have familiar meals and are more likely to eat when they're ill for meals that they're used to having, culturally or whatever. But I don't know. I think there's a happy medium. We know we can make familiar meals plant-based. It's an opportunity to educate, and it's how you present that choice. If the food service hostess went in and said, this delicious, you know, shepherd's pie that I had yesterday, it's really, you know, tasty. And, you know, it's just like everyone would go, okay, we'll give it a try. And
I
that's
had
what it's
vegan
about.
shepherd's pie at lunch.
There you go. There you go. I think if you're at Northwick Park, it's catered by Compass, which is the same menu that I showed you earlier from King. So
Yeah, it's the same at Barnet, same company,
yeah,
same menu, actually.
yeah. But the trouble is we don't want it to only be vegans asking for the vegan menu, and that's why it needs to be front and center of inverted commas the normal menu, and we need plant-based meals to be the norm so that people have to ask for animals should they want it, and that's what they're doing with the work of Greener by Default in New York, now Vancouver. Other places have adopted that sort of approach too.
John, you had a very quick question. We're finishing in a couple of minutes, so.
Yes, about your book, Plant-Based Nutrition in Clinical Practice. I've got a niece who's an occupational therapist, and I was going to get her one for Hanukkah, Christmas. How do you get hold of your book?
Anywhere where you buy books, so wherever you like.
Right, yeah.
Yeah, so
Yep.
I've got kind of a smaller book. There's a Q&A book called Eating Plant-Based: Scientific Answers to Your Nutrition Questions, and then we've got the clinical textbook as well. So yeah, wherever you buy your books, we've got a list, and in fact I'll put it on because I've just created this list. If you want to support your local booksellers, I'll pop it in the chat. We've got a PBHP list at a UK online bookstore that then will send it to you from your local bookseller. That's assuming you want to avoid using Amazon. Obviously, if you're happy to use Amazon, that's probably the quickest. Yeah, there you go. So there's a list of our books in the chat there on ukbookshop.org, and it's got other ones on there as well from our members.
Okay, I'll circulate.
Right. What I'd recommend is if anybody in this meeting has got a relation or a friend or a relation who works in the healthcare system, it'd be a good one to buy them for Christmas or Hanukkah or whatever you call it. Yeah.
Please, yeah.
Yep.
Lots of choice on our list of plant-based nutrition books.
Thanks for the question, John. Thanks for the other questions. I'll take a big thank you for Shireen for taking time out for speaking to us. I know you've had a busy day before this, so thanks again. I'll give you a round of applause.
Oh, thanks very much. It's always great to be connected, and thanks for supporting our work as well.
Pleased to do so.